Journal of Endodontics Club listeners, I'll be overviewing a very recent published article that was published this year on the 1st of February 2023 under the title of Root-Filled Teeth in Two Parallel Danish Cohorts. It's a repeated longitudinal cohort study done by Razdan and his colleagues. First, what is longitudinal cohort studies? It's a type of study which monitor a group of individuals over a period with repeated examinations on the same individuals. They provide information on incidence and persistence of apical periodontitis and the outcomes. Repeated cross-sectional studies provide an idea about the trend of disease prevalence, for example here in the study apical periodontitis, and the prevalence of root-filled teeth in the general population. But the limitation of these type of studies that it cannot assess the dynamic and progression of the apical periodontitis nor outcome of the root canal treatment. The repeated longitudinal cohort study with two parallel cohorts with similar characteristics may provide such longitudinal information, and the comparison of these two cohorts may provide an understanding of the changes in endodontic status on individual as well as on the population level. The design allows the comparison between the two cohorts and compare the repeated cross-sectional longitudinal cohort studies. They aim to compare the frequency of root-filled teeth and the quality of root fillings in two parallel Danish cohorts, each examined during approximately 10 years, and evaluated the factors that were associated with apical periodontitis and resulted in extraction of the root-filled teeth. The first cohort, they involved 330 individuals with a mean age group of 42 years old, and the root-filled teeth at the baseline was 4.7%. While the second cohort had a mean age of 47 years and involved 1,700 individuals, root-filled teeth at the baseline was 3.6%. They first started at 1997 for the first cohort and then followed up the patients for 5 years initially until 2003 and up till 2008 to complete the 10 years follow-up, while the second cohort started from 2009 ending to 2010. So each cohort followed the patients for 10 years. And the parameters that were taken at each visit were the presence of the tooth, of the root fillings, and the coronal restoration. They also checked the presence of the apical periodontitis and the root filling quality. Found that the average number of teeth was higher in the second cohort compared to the first, but the relative frequency of root-filled teeth was lower in the second than the first at both the baseline and the 10-year follow-up. And since the second cohort was done more recently, as mentioned earlier from 2009 to 2019, this finding might be due to the improved general dental health that resulted in lower frequency in caries and subsequently less pulpal and periapical disease, and also the more conservative treatment strategies toward the vital pulp therapies. It was also found in both cohorts that the frequency of root teeth have increased with age, and the most of root-filled teeth were molars or premolars. And when comparing the changes that have occurred in both cohorts over time, it was seen that there was significantly fewer number of new root canal treatments and retreatments that were performed in the second cohort. This might be due to that most periapical lesions are chronic with little or no discomfort and pain for the patients, and due to the limited economy. The predictors for the failures that were identified in this study was the presence of apical periodontitis, the inadequacy of obturation and coronal restoration at the baseline, and the tooth type, which was molar. It was also found that over a 10-year follow-up period, 13% of root-filled teeth have been extracted in the first cohort and around 16% in the second cohort. The limitations of this study was the underestimation of voids, which was most likely to be present in the two-dimensional radiographs. And in the first cohort, they only used the conventional type of radiographs rather than the digital ones, and that coronal restoration's quality was only evaluated on the basis of intraoral radiographs with no clinical examinations at all. And this present study is observational in nature and does not provide information on intraoperative factors which may affect the treatment outcome. Thank you so much for listening. I hope you have a great day.